Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday to talk about free referrals and huge deadlines. Before I get into the important insurance information, I wanted to give a shout out to some of my HAFA family. If you've heard me speak over the years, you know that I consider our membership our family. We're a small boutique association where we all know each other, where we support each other, and I consider you my family. And there's been a lot of trials and tribulations, I think you all know, not only with a lot of our HAFA members, but with me personally. And I just want to give a shout out to a couple of people that have really touched my heart in the last month. I mean, it's only been the last month. The first one is Holly Hale, HAFA Florida, who is our legislative liaison for Florida and keeps me abreast of everything that's going on in Florida. But she sent me some soup, some rolls, and some cookies. So a whole feel good, make your heart feel good meal. Well, it was more than one meal. It's a big thing of soup. But it was so sweet of her. And then the next thing I got in the mail from Miss Pat Isaac, who is a HAFA member from Maryland and also one of my study group partners, sent me this beautiful, hopefully you can see it, beautiful angel wing bracelet. And I mean, you can see it's gorgeous and perfect for some of the trials and tribulations that I've been going through lately. So thank you, Pat. I love my bracelet. And then this week, I was surprised to get one more. I mean, I keep saying, how am I so blessed? What did I do to deserve such wonderful friends and family? But Miss Barbara Garcia from Texas sent me the coolest thing, and hopefully you can see it. You can see a couple are gone. But they are cookies. They're Oreo cookies, and they are dipped in chocolate. Some have my picture, some have HAFA's logo, some have Faith's picture, and some have inspirational sayings. So I was so surprised, so honored to get these cookies, and especially them having my baby and our HAFA spokesperson, Faith, who had her 6th birthday this weekend. So thank you, Barbara Garcia. Thank you for everyone who just stops and sends me a Facebook message or a text and just says, you know, thank you for everything that you're doing. That means so much to me. To know that you understand how hard that I'm working. But enough about prizes and presents and flowers I've gotten and the whole setup to do my HAFA Lives that we got from Agents from Hope. I'm just blessed. Can't say it enough times. But let's talk about free leads and huge deadlines. I know a lot of us pay to get leads. And through CMS and through the federal marketplace, you can actually get leads for free. And some of you may know about this, but traveling pre-COVID, I spoke to agents across the United States and was blown away by the folks that did not and had not ever heard on Help on Demand. This is a wonderful program to give you leads, and they're actually doing some updates to the program to make it a little bit easier for consumers to understand they're reaching out to an agent and broker. But what happens is a consumer will go onto the marketplace, they realize that they need our help, which they always do. They'll click on Find a Local Agent, and it will connect them directly to the person closest to them based on their address, their zip code. It will send you a text message or an email, however you set it up, and let you know that, you know, their name and their phone number need your assistance. You have, you know, a certain amount of time to give them a call back and respond. You can say, I can't help now, and it'll go to the next person. So it's not like, you know, if you're in the middle of an enrollment, you know, it's okay. They're just trying to get the folks help. Now, if you say, I don't want to help 90% of the people, then you could be removed from the program. So you want to make sure that you pay attention to the program. But it does work. I know people who have gotten tons of leads through the marketplace the last couple of years and have made some money. Now, I will tell you, there will be a few that are Medicaid eligible. So be prepared for that. Put the Medicaid number on your desk, and when you qualify them for Medicaid, after you've asked your questions, then you simply tell them you believe that they're eligible for Medicaid, and you can simply give them the phone number. If you would like to help them through the healthcare.gov site or one of your web brokers, you can do that, and then the healthcare.gov program will send them to Medicaid, however you would like to handle it. But you must do training in order to have help on demand. So you do the training, you sign up when you would like to have calls. Maybe you only want to have calls from 8 to 10 Monday through Saturday, or Monday through Wednesday, or whatever. You set it up however you'd like to have it. Maybe you want to take calls 8 to 8, because realizing some of these people do not call until after they get off work. However you want to set it up, you set it up. But you must do the training. You must set it up to say when you want to take the calls. But free leads. I mean, no money out of your pocket. Takes a few minutes to do the training. Easy peasy. I encourage you to look into it. The other thing, huge deadline. Marketplace registration training for 2021 must be done by October 22nd. I would do it by the 21st, because there's going to be last minute people and the system could get, jammed up. So you want to make sure to get that training done. If you're a returning agent, there's a shorter version for you to take. Not real complicated. I did it myself. If you are a new agent, I encourage you to try it out. It's not going to hurt for you to do your training, get your certificate, do help on demand, and see how that works this year. There are some new players in some of the states. We're not going to mention the ones that aren't paying commissions. United Healthcare I said their name. I did it on purpose. In Maryland and Virginia, or Oscar not paying in New York. Besides those folks, there are some other people that have joined the marketplace and could possibly give some folks some help, especially this year with COVID and so many people that came off the employer rolls and so many people that are out of work that, did have income at the beginning of the year, didn't have income, mid to the end of the year. So they could very well qualify between that 100 or 138% of FPL to 400% and get some help. Make sure that you tell all your marketplace folks, it might be a little bit too late to tell them now, but constantly tell them they must do their taxes. Not only that, they can say, I did my taxes, and their tax credit was taken October 1st, happened to people across the United States. They didn't do the 1095 or 8962. They must file their taxes, and this is for 2018 this year, maybe 2019 next year. They must file their 8962 using their 1095. Very important. I know several people that low income, barely made any money, and the total amount was taken out of their checking account. If you think that you're going to get that fixed with the marketplace, God bless you. I know somebody that worked on it for 2 years and still never got her money back. So we just need to, as agents, stay on top of that. Make sure that they understand that has to be done, and the government is not playing. They will take their tax credit. So we need to be very diligent about that. HAFA has put up our marketplace checklist. I had a call with CMS the other day, reiterating the fact that, number one, you need to make sure you have their consent. The HAFA form does have a consent telling them exactly what you're going to do with their information. They reiterated that you're not supposed to use your agent address as your application address. Very important. Do know that they're watching everything that we do, and they're paying attention, and they're coming after anybody that they think might be doing something incorrect. So make sure, keep your nose clean, keep your records, make sure to keep those consent forms, make sure that you notify your marketplace clients exactly what's going on, what they need to do, how they need to stay in compliant, and make sure that everything's done between November 1st and December 15th. Now, something that came up that was a little surprising to us was the fact that, and I guess I didn't realize it because CMS said it's something that's always done, but Health Sherpa said that they'll have preliminary rates in their system prior to November 1st for window shopping. Now, if you use Health Sherpa, I'm not sure if it's all web brokers, and if you know, let me know so I can let the rest of the members know, but you could actually go in and do some preliminary work if you know the folks a new income and everything for 2021 or what their projected income is, because we know that's a guess. But, you can do some preliminary work for November 1st, so you're ready to rock and roll November 1st through December 15th. Now, remember, I'm going to give you this warning, heed it if you want. A lot of people start making their appointments November 1st. I'm going to tell you, don't do it. It's happened every year that there's been a glitch. CMS said that they have, done everything that needs to be done. They're ready to go. All the glitches are out, but something always seems to happen. So give the first couple of days a rest. Do your background work, but don't set up any appointments. Don't stress your folks out because just beware that something could happen. Also know that we're going to have to do things different. They're depending on the state, depending on the county, depending on the parish, whether you have to wear a mask, whether it's scary to meet somebody in person. Remember, a lot of folks use Zoom, a lot of folks use just, the phone. So however you think is best. I know some elderly folks, they just want to meet. They're the most susceptible, but they want to meet. They want to see you. They want to talk to you. In those cases, just be safe, take precautions, and just be prepared, have everything you need so the meeting is not really long and you get your point across and you help them as soon and as quick as possible. So free leads, huge deadline. Get it done. And I know our folks are stressing third quarter. You might have already got all your work done for third quarter, January 1st, but some of you are still working hard. Let me know if you need anything on that. Please check the HAFA website under the partner page, and it will give you some huge partners that will help on self-funded, pulling high cost of drugs out. I mean, all kind of things. We do have Education Thursday, the next 2 Thursdays, and on the 22nd, which is this Thursday, we'll have one on compliance. Now that you are selling groups down to 2, everyone needs to take the CE class. Compliance done by Angie Sir of Navigate HCR and hosted by New Synergy. They have come together and are going to offer a program that I think that will be very beneficial to every member. So free CE, Louisiana, Texas, Connecticut, Nevada, Georgia. So we got a huge list of states, still working on more states, working on California. I told y'all that. That one's a little bit harder for me to get. And then on the 29th, next Thursday, is Angie's doing one on ERISA. One of the best CE classes I've seen, same states. Angie, Vice President of Compliance, Navigate HCR, and then hosted by New Synergy, Jason Gavin. So encourage you to go ahead and register. Make sure that you're signed up. Make sure that you join. I can tell who is on the course and the class the full time by the GoToWebinar system. So you must stay the whole hour. The states are very specific on how I handle this, and I want to make sure that we never lose our provider titles in those respective states, that we do what we're supposed to do. So please realize that in order for me to give you credit, I have got to have you on there for an hour. Now, if anyone has attended some courses in the past and you don't see them listed, everybody should have theirs listed. But if you don't, please let me know, because I've had some problems with Louisiana where I've had to input it more than once. So just send me an email. Let me know, Ronell, I don't see it. It should be there. There shouldn't be any reason if it's was done correctly, which I thought I did, but hey, I make mistakes. I want to do it again. I want to make sure that you got your credit, because we've done several CE credits over the last couple of months. Know that this CE in October is the last one for 2020 because of Medicare open enrollment and because of the Marketplace open enrollment and third quarter. We still have our power hours, our legislative calls, and all that, so that's still going. But we will stop our CE and start it again in January. Also, remember that we moved the summit to the end of August, so definitely let us know if you have any speakers you'd like to consider. We're sending out our sponsorship programs. If you'd like someone to receive a sponsorship packet, we have a beautiful packet put together that our Vice Chair of Membership and Marketing, Tori Parker, put together. So gorgeous. You might have, if you're a Facebook fan, you might have seen that our wonderful Tori Parker has announced that she is going to be a mom. Trish is going to be not a grandma, but she's going to figure out what that name's going to be. But she's going to have a grandbaby. So that's exciting news for our HAFA family. I did want to let you know that there are some states that they've done a survey and they do not think that they need agents due to the high health coverage market concentration. So I just wanted to give you a list of these, and you probably won't find it surprising. Number 5 is South Carolina. Number 4 is Delaware. Number 3 is Michigan. Number 2 wasn't a surprise to me, Hawaii. And number 1 wasn't a surprise, and that's Alabama. Blue Cross of Alabama has a tight captive audience of how they control agents. And honestly, we really don't even have any members in Alabama because of that. It is what it is. Some good news from Florida. SB 292 was passed and signed by the governor. It gives you, agents and brokers, the opportunity to help your clients get group data, their claims data. Huge. So one of my study group partners from Florida told me about this bill. I said, leave it up to me. I'll figure it out. I'll find out what it means, because it was very evasive of the way it was written, what it really meant. So I reached out to the senator, the author of the bill, and talked to his staff last week. And they wrote it like that, so it included health. So it includes health, doesn't say what size, so it goes down to the minimum in Florida. It goes into effect January 1st. I'm hearing from some agents that the carriers say, hey, we don't know about that law and we're not going to adhere to it. Well, I'm just going to tell you, it's there. If you need more information, you call me. I can connect you with the staffer at Senator Broxton's office that absolutely said, let me know if you have a problem. It was written that way. We want it to be that way. And it should help you as you're trying to not only clarify that somebody should have got a rate increase, clarify that they shouldn't have got a rate increase, and be able to move them and shop them. The insurance carriers won't have that throat hold around you anymore, that you can't move a client because you have no idea if they even had the claims they said they had, and played footsies with you on whether they had 100 lives anytime during the year. So I've heard a lot from agents and brokers in Florida. So please, 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 let me know. Also, oh, that might be the end. That's been a long HAFA Monday live, and please know that I'm here if you need me. Much love to you, your families. Stay safe, regardless where you are and what's going on in your state. Call if I can help. Join us Thursday, and until next Monday, have a wonderful, wonderful week.